Yeah. Today we're going to talk about injuries associated with basketball. Now, there can be many injuries associated with basketball. It can be a knee ligament injuries, it can be a shoulder dislocation, it can be an ankle sprain. But let's talk about a very common one, and one of the commonest is actually pain in the front of the knee when jumping. Now, this is what the patient presents to us with, which is pain in the front of the knee, and it's worse when they try to jump, and it's so bad that they cannot jump. And usually when you examine them, the pain is, when you examine them, the pain is at the front, and if you examine, it is at the lower part of the kneecap. It is at what we call the junction, the lower part of the kneecap, insertion into the shin bone. This is called a patellar tendon. And what they have is they have pain in the patellar tendon. The diagnosis is patellar tendinitis. Now, this condition is painful when they try to jump, it's painful when they try to run. And the treatment usually is physiotherapy, take some simple analgesics, which is some painkillers, and do eccentric exercises. Eccentric exercises means try to strengthen in stretching. Occasionally, very occasionally, these patients may require surgical treatment. To avoid patellar tendinitis, one should do a lot of stretching and build up core muscles. Core muscles means have strong pelvic muscles so that your hip muscles take off more of the load when you're running and jumping, and you don't rely so much of the running and jumping onto your knee joint. So you offload the stress from the knee to the hip. Yeah. Right.